today is Thursday, June 22nd, 2024. So we passed the hump day for the week. And Friday's weekend, Friday, TGIF. And there's my payday, because my payday is June 25th, where the Korean War broke out 70 years ago. And since it falls on Sunday, my company backwards the payday onto the first weekday, which is Friday 23rd. So tomorrow I get paid a lot of money. I don't know, because it's not a bonus day, it's just plain all day. I think I have a lipoma on the back of my back, so I just pulled off of this one from the internet, and I'm gonna read this as a part of my English study. So here we go. This one is from Cleveland Clinic. Lipoma. A lipoma is a lump of fatty tissue that grows just under the skin. Lipomas move easily when you touch them and feel rubbery, not hard. Well, I don't have a lipoma then. What is it? I have I don't know, it's not a cancer, but what is it? Most lipomas aren't painful and don't cause health problems, so they rarely need treatment. If a lipoma is bothering you, your provider can remove it. Overview. What is lipoma? A lipoma is a round or oval-shaped lump of tissue. It's not round on my back, that grows just beneath the skin. It's made of fat, moves easily when you touch it, and doesn't usually cause pain. Lipomas can appear anywhere on the body, but they are most common on the back. Yes, I think it's part of lipoma maybe. It hurts a little bit. They are most common on the back, trunk, or torso, arms, shoulders, and neck. Lipomas are benign soft tissue tumors. They grow slowly and are not cancerous. Most lipomas don't need treatment. If a lipoma is bothering you, your healthcare provider can remove it with an outpatient procedure. That's good expression. With an outpatient procedure. What's this smell? With an outpatient procedure. With an outpatient procedure. With an outpatient procedure. How common are lipomas? Lipomas are very common. About 1 of every 1,000 people has a lipoma. Lipomas appear most often between ages 40 and 60. Here, you gotta be careful, man. It's ages 40 and 60. It's a plural. When it's just 40, age 40, it's a singular. But here, 60, 40, they are two. So it's plural. Ages 40 and 60. But they can develop at any age. They can even be present at birth. Lipomas affect people of all genders, but they are slightly more common in women. Symptoms and causes. What are the symptoms of a lipoma? Lipomas aren't usually painful, but they can be uncomfortable if they press against a nerve or develop near a joint. Many people who have a lipoma don't notice any symptoms. Lipomas are usually encapsulated. They don't spread to the tissues surrounding them. Painless, however, some lipomas cause pain and discomfort depending on their location, size, and if blood vessels are present. Round or oval shaped. The fatty lumps of rubbery tissue are usually symmetrical, round or oval shaped. Round or oval shaped, symmetrical, painless. Movable. They sit just beneath the skin's surface and move when you touch them Well, it does move on my back. I think it's a lump. Maybe I have cancer. I don't think so because I've been practicing anti-cancer Tai Chi work for 5 years now. Smaller than 2 inches in diameter. In a few cases, lipomas can be larger than 6 inches wide. Where do lipomas grow? Lipomas can develop anywhere on the body. Rarely, lipomas grow on the muscles, internal organs, or brain. The majority of people with lipoma only have one, although more than one lipoma can grow. Most lipomas develop just under the skin on the arms or legs, back, neck, shoulders, trunk, chest, and torso, forehead. What causes a lipoma? Our healthcare providers aren't sure what causes lipomas to grow. They are inherited, passed down from or through families, passed down through families. That's good expression. Passed down through families. Some conditions, you are more likely to develop a lipoma if someone in your family has one. No one has one in my family, so lipomas don't get passed down through my families. Some conditions cause multiple lipomas to form on the body. Usually it's one, but multiple lipomas can develop under the skin, on the parts of your body, right? Lipoma causing conditions include Dekram's disease. This rare disorder causes painful lipomas to grow, most often on the arms, legs, and trunk. It's also called adiposis dolorosa or Anders syndrome. Gardner syndrome, a form of disorder called familial adenomatous polyposis, FAP. Gardner syndrome causes lipomas and a range of health problems. Hereditary multiple lipomatosis, also called familial multiple lipomatosis. This disorder is inherited, passed down through families. Madelung's disease. This condition occurs most often in men and who drink alcohol excessively, also called multiple symmetric lipomatosis. Madelung's disease causes lipomas to grow around the neck and shoulders. How are lipomas diagnosed? Providers usually diagnose a lipoma during a physical examination. Your provider will touch the lipoma and ask if it's painful or tender. If you may need a biopsy to confirm that the lipoma isn't cancer. During this procedure, your provider removes a sample of the lipoma and sends it to a lab for testing. Oftentimes, this may be mistaken for a cyst. To see a clear picture of this lump, your provider may order an imaging test such as an ultrasound, magnetic resonance imaging, MRI scan, or computed tomography, CT scan, an imaging test. These imaging studies help your provider determine if it is a lipoma versus a cyst. It can also help identify the lipoma's location and how deep it is, if it has blood vessels, and whether it's pressing against nerves or other tissues. What are the types of lipomas? All lipomas are made of fat. Some lipomas also contain blood vessels or other tissues. There are several types of lipomas, including angiolipoma. This type contains fat and blood vessels. Angiolipomas are often painful, conventional. The most common type, or a conventional lipoma contains white fat cells. White fat cells store energy. Fibrolipoma, fat and fibrous tissue make up this type of lipoma. Hypernoma, this kind of lipoma contains brown fat. Most other lipomas contain white fat. Brown fat cells generate heat and help regulate body temperature. Myelolipoma, these lipomas contain fat and tissues that produce blood cells. Spindle cell, the fat cells in these lipomas are longer than they are wide. Pleomorphic, these lipomas have fat cells of various sizes and shapes. What is the treatment for lipomas? Most lipomas don't need treatment. If a lipoma is bothering you, your provider can remove it surgically. Lipoma removal procedures are safe and effective. You can usually go home the same day. As an alternative to lipoma surgery, your provider may recommend liposuction to remove the lipoma. Your provider uses a long, thin needle to remove fatty tissue from the growth. Prevention. Can I prevent lipomas? Lipomas and many of the conditions that cause lipomas are inherited. Since they are passed down through families, it is impossible to prevent them. You can lower your risk of developing Madelung's disease, a condition that causes lipomas to grow, by limiting the amount of alcohol you drink. What is the outlook for people with lipomas? Many people live with lipomas and they may not even notice them. Most lipomas don't need treatment, but providers can remove them if necessary. Lipomas rarely grow back after lipoma treatment, but another one may grow in a different spot on your body. When should I see my healthcare provider about lipomas? If you have a skin growth, lump, or knot under your skin, see your provider. It's essential to get evaluated and rule out serious conditions such as liposarcoma, a type of cancer. The symptoms of liposarcoma are similar to signs of lipoma. If you have a lipoma, see your provider if you notice any changes such as sudden pain. Call your provider if it's growing rapidly over weeks, feels hard, and doesn't move as easily when you touch it. Your provider will check the lipoma to see if it has blood vessels, which is a sign of a rare type of painful lipoma called angiolipoma. A note from Cleveland Clinic. Millions of people live with lipomas. They can be annoying and unsightly, but they don't usually cause problems. Most lipomas don't need treatment. But if a lipoma causes pain and you are concerned about its size and location, see your provider, right? Why? And usually providers can remove the lipomas during an outpatient procedure, which means you will probably go home the same day. Lipomas rarely grow back after they have been removed.